Welcome, Helinä. You will start presenting what Protect project. It's always very hard to say that, but I like the word anyhow. So welcome, Helinä. I give the word to you.
Yes, many thanks, Bent. And my presentation will come soon, I'm sure. So I am, as Bent already mentioned, I'm a professor at Lahti University of Technology in Finland. I'm the coordinator of Protect project, and I'm also the chair of this Nordic Research Network on Health and Welfare Technology this year, in line with Finland's presidency of, or in the Nordic Council of Ministers. And now I will tell you a little bit about this project, the Protect project. Next slide, please, so that you know about the background of this webinar. So I wouldn't need to tell you who are listening to this webinar and participating today that the use of health and welfare technologies is playing an increasingly important role. We know, you know that very well, but we also need to keep in mind that it's not only a role in users' lives, but also in care work, care processes, care organizations, and then in our Nordic societies as a whole. So we need more and more understanding of end users' needs. Very importantly, we also need understanding of informal caregivers' needs. So, for instance, when we talk about older people, their relatives or their family members' needs. We also need more and more understanding of implementation of technology, and then systemic understanding related to both organizational and societal levels of the use of health and welfare technology. Proactive, that's a word in the title of this project of ours, and proactiveness is really an important aim when you talk about health and welfare technology, because we often see situations where technological solutions are taken into use too late. So in a way, you could even say that when there is a serious need for health and welfare technology, it may be too late to really get the benefits out of the use of that technology. So it should be earlier that this kind of technology is taken into use, so that we can also avoid, or let's say, previous slide, please. Yes, so that we can also avoid problems before they even arise. Our Nordic societies are in many ways quite similar. We have relatively similar care systems and societies. Of course, there are also very many differences, but still, this area, this region provides an excellent environment for research on this topic. Next, please. So Protect is a networking project to synthesize and advance Nordic research-based knowledge of this proactive health and welfare technology with all these perspectives that I mentioned earlier. My university is the coordinating university or organization. Then we have Norwegian Centre for eHealth Research, Danish Dementia Research Centre, and Mälardalen University from Sweden as partners. Our funding comes from the Joint Committee for Nordic Research Councils in the Humanities and Social Sciences, and currently its secretariat is at Academy of Finland. And our activities are also supported by Nordic Welfare Centre, and then this research network. And next slide, please. We have these Nordic workshops where we focus on the 3 levels of end users and also their informal caregivers. And by end users, I don't only mean, for instance, older clients or patients, but also people with disabilities and, well, basically also other age groups who may benefit from the use of health and welfare technology. Then we focus on implementation, the perspective of professional caregivers and care organizations, and the societal level. This group of researchers involved in the project is truly multidisciplinary. And we also have many stakeholders participating from our 4 countries. So this transdisciplinarity principle is very important for us to also discuss and hear from various types of stakeholders, including the public sector, the private sector, and non-governmental organizations. An important additional feature of the project is that we support early career researchers. We have many early career researchers involved in the project, and we give them opportunities to present their research and discuss that together with other researchers. And our very basic aim is also to understand the diversity of users and really value their voices and narratives in our research and in our project. Thank you.
Thank you, thank you, Helinä. And as I understand it, the what we will hear now coming up from you and Christina and Elin is the results of the first workshop that was performed, and that was the first of 3, wasn't it?
Yes, that's right. Yeah.
And then focusing on end users and users, and then there are planned for 2 more workshops coming up, isn't it?
Yes, that's right. So the next one is in the end of March next year. So that focuses on this implementation level, professional caregivers and care organizations. And then the last one is in September 22, and that focuses on the societal level.
So you started on the right with the right perspective. You started up with the end user and the user stakeholder perspective here when you started up this project.
Yes, I think it's quite a relevant whole of perspectives that we have.
Yeah, the bottom-up perspective, so to speak. Yeah, that's good. We like that. Thank you, Helinä. You will come back soon. But now let's go over to Christina and Christina and hear about the synthesis on the challenges, on the Nordic challenges based on what we figure out during these 2 workshops days in the hybrid meeting. Welcome, Christina.
Thank you. And yes, my assignment today is to present the synthesis of the Nordic challenges, and I will also later on be one of the panelists in the discussion we will have after the presentations. Yes, and here is the slideshow. We have the great opportunity to have Raquel with us during the workshop, and I think what she's doing is called some kind of visualization of the documentation from the workshop. So we will use her pictures of the discussions we have. So next slide, please. And what you see now is the summarization by Raquel of the challenges that were presented in the workshop. And I will walk you through the challenges that was presented from each country team. So we will start with the Norwegian challenges. So next slide, please. One of the most important challenges that was discussed in the Norwegian workshop was the loss of universal design of development of health and welfare technology. They also stated that the user involvement must be started early on. They must be included in this work. And we also need to look into the timing of the training of the users. For example, if you have a person with dementia, we must start in very early stage to introduce this technology that might support them in their daily life. We also have a challenge in digital illiteracy and also some kind of knowledge need, that we need to learn more about this kind of technology, but also how to use it. It's also about the basic training of, for example, nurses, but also social care and healthcare professionals, the professionals that will support the users of this technology. And we also, the Norwegian workshop also said that today we have a very fragmented services. There are many actors, many professionals. It's a complex field to navigate into. And there's also an ongoing displacement and task shift. So if we move to the next slide, it's about the challenges that were discussed in Finland, the Finland workshop. They identified that the participation opportunities and that we need to listen to the users, but not only the patients or all the people with needs. It's also about the relatives and professionals, also as users, and also in the decision making when we choose what kind of technology that would be in use. It's also about that we in early stages need to work with the digital skills. So this is about the proactiveness in this field, that we need to be more proactive compared to be reactive. They also discussed the provision of knowledge that need to be worked with in early stages, and really early stages, maybe before you even know that you have the needs that will for some kind of health and care, healthcare or social care, where you could use technology to encounter the needs. And it's also about that co-creation requires many resources. It's also quite often discussed that we need to work with co-creation processes, but it takes a lot of resources. It's neither an easy process, and we not always have structures that support that, and we need to work with that in the aspect of sustainability. And when we look into the Swedish workshop about the challenges, the next slide, please. There it is, yes. And the Swedish workshop stated that we are in the middle of a demographic challenge with a growing amount of older people, and there are also fewer workers that will be available to do the care work. So we need to look into other ways to deliver care and support and healthcare. What was also stated that we are living in what could be discussed as technology optimism, that there are massive expectations of what technology could offer us. And maybe we have to be a bit more pragmatic in that discussion. Technology is not the only solution that is available, and technology can't help us with everything. And it's also about, which was mentioned from the other country teams, that the knowledge question related to competence and the digital exclusion is also challenges we need to handle. It's about competence in common for the citizens about using digital ways in your everyday life, but it's also about the professionals' competence in this way. And also about the question about exclusion due to that not having, for example, internet, or that you might not have the skill to use this kind of technology. And it's also about participation in service design and the use of this kind of technology. And from the Denmark workshop, the next slide, please. It was concluded that, or discussed that there are implementations issues we need to handle, as well as the timing of implementation. It can't be too late, so it must be in an early stage, to handing over only when people come to home from the hospital. We need to work with the competence in much earlier stages. It's also about compliance issues, which causes barriers also for professionals. And the environment must be appropriate for the technology in questions, which also leads to discussion that there is no one solution for all when technologies and users are matched. We must look into the individual's needs and also the environment or the context where these individuals are living their lives. They also stated that one challenge is that we don't have enough professionals with resources or knowledge in this field. And it's also, of course, about data security and safety issues, and also ethical issues. This must always be considered when we're working with this kind of technology. So finally, when I'm trying to synthesize the challenges, which is on my last slide. So next slide, please. We can see that all the country workshops were talking about early user inclusion and involvement in design, innovation, and in decision-making processes. And this is when I talk about the users, the relatives, but also the professionals. And if we want to work with co-creation, we must know or understand and take into account that it requires many resources. So we must work with this in a sustainability way. It's also about knowledge, skill, and education issues. The public knowledge in the citizens about how to use the digital technology, but it's also about the training of the professionals. And when looking into this issue, it's considered that there must be digital or health and welfare technology content in every education for these professionals who are supposed to work in social care and healthcare. It's also about resilience in relation to new solutions. As we all know, the technology development, it goes quite fast. So what we buy today might be old tomorrow. And here we must have strategies and also business models that allows us to always have possibility to use the newest technology that best helps us to solve our problems or needs. And when we look into the idea of universal design, or it might be a tension due to the statement from the Danish team, where they said that there is no one solution for all. So here is a tension, or maybe a possibility how we could work with the design and also user involvement in design. Of course, we must consider safety, security, ethical, and legal issues in this area. There is also fragmented services. There are many actors, and this is considered as a complex field to navigate into. And finally, it's also about implementation and compliance issues. We need instruments or methods to look into and also find the evidence of the effects of using this kind of technology to handle and also understand the technology optimism in this area. So thank you. Now I leave the floor to Helinä.
Yeah, perfect. You did my job now, saying you give the
Sorry.
There's no problem. Okay, thank you, Christine. And then we come back later when we have the discussion. And back to you, Helinä, to look at Nordic trends then And then we
Yes.
can, take the next slide.
Yeah, thank you. So I will present this synthesis or this Nordic trends part in a similar way as Christine presented it, the challenges. So go through each country then first and then a synthesis slide. So next slide, please. First about the trends that were expressed concerning Norway. The government is focusing on how to provide more holistic services. So there is a movement or a tendency to move towards more holistic care. This was shown in the workshop, for instance, so that it was really emphasized that it's about users. Health and welfare technology is about users and not technology. Technology itself, not about devices or solutions, but really people are really, really important. Telehealthcare was discussed, and this third point is actually related to the first one too. So it was emphasized that there is a need or a tendency, a trend to move from single solutions to various platform solutions, providing more comprehensive services, and thus also the infrastructure becomes more complex. There are these emerging technologies or newer technologies more and more in use in Norway. Chatbots and robots were mentioned. And more piloting and research is needed on these issues. For instance, on everyday technology, the role of technology in our daily lives. It can often offer more time to be together in one way or another if we use technology. And we also need to focus on how we actually understand technology together and individually. Next, please. The trends in Finland, I need to also mention that it wasn't easy to kind of capture the essentials from these country sessions because the discussions were so lively and there were many people involved and many kinds of stakeholders as well. So this is obviously somewhat arbitrary in the sense that we cannot tell about everything that was discussed now during the webinar. But in Finland, it was quite clear that safety and security, increasing the sense of those is essential, an essential national trend in the use of health and welfare technology. Then usability issues are being discussed more and more, so that we shouldn't just look into having separate gadgets in people's use, but we need to focus on how they are easy to use and also solutions that can be adapted, tailored to individual needs. Whether it's a question of needs of clients or professionals, or even as well these informal caregivers. It was also emphasized that we need solutions, or it is a trend to focus on solutions that are suitable for networks of service providers or networks including different types of organizations and care professionals in a network, so that we also at the same time are able to increase knowledge in the network. Knowledge related issues are very important when we talk about health and welfare technology use, but currently solutions are still often in silos. So this is actually related to what was discussed in Norway about these about the trend of providing more holistic services. So we should get rid of silos in service provision. Interaction was mentioned as a trend, emphasizing its need We probably all have realized that the corona pandemic has changed attitudes towards use of technology, also to increase opportunities for interaction between people. And remote care was mentioned as a trend as well. Next, please. In Sweden, the key words, so to say, that were discussed with regard to trends were digital transformation, proactive activities, demands of digital caring support, and independency. So it was mentioned at the workshop that, or it was felt that Sweden is a bit behind in the social care and primary health care in terms of digital transformation. So there would be more opportunities than are currently used. There is also a trend of talking about this proactiveness more and more. For instance, newly retired people are planning their later life to an increasing degree. But of course, you also need to talk about this proactiveness from the point of view of service providers and the service system. So it's both an individual issue and a service system issue and a service level issue, how to try to ensure more proactiveness in the future. In Sweden, it's clear that citizens really want to have digital healthcare. There is demand for it, and also staying independent is seen as a high cultural value in Sweden. Next, please. Moving on to Denmark, technology at home, that was emphasized as a trend, and also health parameters, health awareness, and sharing of data. So there is already lots of health and welfare technology implemented in homes in Denmark, and this is visible both in treatment and also monitoring. New technologies such as virtual reality and augmented reality were highlighted as a trend in this area of care services. And then the topic of health awareness was also brought up. So we can see that health and welfare technologies obviously enable greater awareness. We can monitor our health better and better, and therefore also become more aware of the current situation. Whether that then leads to action, that's of course depends on the individual. It was also emphasized that there is willingness in Denmark to share data that is produced in daily life monitoring for research purposes. And this is an interesting note as well, because at least in all the other countries, it was not so clearly expressed. Next slide, please. Then to a synthesis list. So in all countries, there is a trend moving towards more holistic services. Of course, there are still many questions related to how to provide them in practice. And that's also can be, there are these national differences in the provision of care services. But in general, this was, there were many issues that were really similar. As a second point here, it is there is this silo issue. So we need to think about network perspectives, and those are thought about more and more in the 4 countries. And also the trend of moving from single solutions to platform solutions. That was a joint issue as well. Remote care, telehealth, technology at home, distance spanning solutions, whatever concept is used, that is a trend, and also for different kinds of purposes. in addition to these treatment and monitoring, also interaction. Another trend was citizens really wanting to have digital healthcare, and the reasons for this are independency, safety, and security. And there is a great need or a trend towards kind of asking and finding out about everyday technology. Usability issues were important in all countries, solutions that can be adapted to individual needs and users' needs, and are also easy to use for all. Proactiveness was mentioned by all. Health awareness was perhaps more emphasized in Denmark, but this is also something that we can perhaps then discuss in the discussion how it is in our 4 countries. Data-related issues were also emphasized more in Denmark, but this is something that characterizes the research also in the other countries. Newer technologies obviously interest all countries and all actors in our countries, and the need for more and more piloting and research, also implementation research, was the final point on this list. And I will hand over to Bent. Thank you.
Thank you very much. Thank you very much, Helinä. It's very interesting to follow all this. I participated in this 2-day workshop and to see all this that are gathered and put down in these areas, and we'll get back to and I hope we raise a lot of questions for you that are listening to this and coming back after Elin has presented. The next step of this is the synthesis of present and future research needs here. What came out of these 2 days hybrid workshop. So Elin, I give the word to you.
Thank you. Yes, I will try to make a synthesis. And next slide, please. And here we have the same picture as an overall view. All participating countries had also their own discussions regarding present and the future research needs, but I will just jump directly to the synthesis, so we will not repeat each other too much. So next slide, please. When I did this synthesis, I found 5 main areas that I want to present. Maybe there are more, but it was not easy to cover all things that was discussed. But I have these 5 main areas, and the first one is digital exclusion. And we discussed that we live in a time of rapid technology development where more and more areas are being digitized. And at the same time, we know that there are large groups that are outside the digital development, such as elderly and people with cognitive challenges. So we need research on what is needed to include more people in digital development. How can we design inclusive services and technology? We also need to know more about how we can motivate those who are non-users. And here we just were discussing, could this be a relevant topic for a joint research project between the Nordic researchers in this group? We also talked about when doing research on digitalization, it's also important not to only study the current needs, but also consider what needs will be in the future. And in future, there will be more older people that are used to technology. And of course, at the same time, the technology will have changed. And it's not easy for us to know how the technology will be in future, but it's important although to try to find and see what are the trends for future and take also these trends into consideration. And at least it's also important to see and learn more about the societal perspectives of digital exclusion, because I think also in future there will also be people that are digital excluded. We have also seen that the implementation of technology is a complex field with many challenges. Or for the technology to be used, it's necessary to involve users at different levels to an even greater degree than we do today. And there's a need for new methods of involvement, especially for the involvement of marginalized groups. We also need to develop methods for co-creation that involve all actors to deal with the complexity of implementation and use of technology. So next slide, please. I was maybe slow to say next slide. So this is about the new methods to involve users and also how we can cooperate with different stakeholders. So next slide. Another topic was this implementation of technology. And we have demographic challenges that in the future will put great pressure on the health services. So therefore, there will be a lot of pressure on the municipalities to implement technology solutions to streamline their services. So therefore, we need research on how we can design services for the best possible quality and efficiency. And therefore, we need both client-centered and organization-centered research to consider the complexity of implementation of technology. And also, multidisciplinary research is necessary, as we have mentioned before, to avoid silo thinking. There is also a need to increase the competence and to have in-depth knowledge on why technology is not used. As mentioned, multidisciplinary research is essential, but this can be a challenge to achieve because disciplines use different terminology. There should be more focus on concepts and terminology so different disciplines better can understand each other. And we also see that we surround ourselves with technology in increasingly more areas. Therefore, there's a need to study how we can align ourselves with technology in several areas in our lives, in houses, at work, and also in connection with various activities. Next slide, please. We were also discussing that we need more research into the ethical field, and also we need more knowledge on security, safety, and I think we also should have added legal issues on this picture, but I say it's an important aspect. And also I think also as a response to developers or vendors technology optimism, where they must understand, they may not understand where technology is needed and what kind of technology that suits best sometimes. We therefore need to understand people everyday needs and the practical conditions and limitations in homes and workplaces. So this is also an ethical issue, I think. So next slide, and the last one. Different methods for research were also discussed in the groups. And in order to respond for the research needs that we have outlined, there's a need for different approaches. We need both qualitative and quantitative research. We need to use valid instruments and also relevant theories in research. And where there are no valid instruments today, we should develop and test these instruments. In addition, there's also a need for large multidisciplinary studies to embrace the complexity in this field. I think this was the main areas that I have found in the discussions. Of course, there were more topics, and maybe also in the discussion more topics will come up, I suppose. Thank you.
Thank you, Elin. Thank you very much. Thank you all three. This is it's so much coming here, so many things that are so interesting to hear about. And I must also underline that one practical thing here is the illustrations you've seen that is made by Raquel Ben-Mergul, that was very impressive for us that were part of this workshop, because she did these illustrations during these two workshops at the same time. And when they are available, you will see more of these illustrations from the report of this work coming up. And I think you all could now put on your cameras, please. And we will open up now for possibilities to put questions to Helinä, Kristin, and Elin based on what they have been presenting here. So, and what we do is you raise your hand so I can see who wants to give a question or to say something, a comment and question to the panel. While you're thinking about that. I could maybe just say that what we haven't said is that we have said that this was a 2-day workshop with a hybrid solution, because it was supposed to meet physically, but due to certain circumstances that you all know of, it was started up to really be a hybrid meeting. I think in Finland you had a total digital meeting, didn't you? And but in workshop, but in Sweden, Norway, and Denmark, we met nationally, physically in place, and had these workshops together. And I think there was over 60 participants in all for these 2 days from all countries gathered. All these, and it was stakeholders from researchers to also participants from authorities and from professions, but foremost also stakeholders from the user perspective area. So that was very important to have. But I could start with a question to you. Do you think this result is mirroring where we are here and now, but has it also a future perspective? What do you say, Kristin?
Regarding the discussion and also the presentation from the country workshops, I think the content were mirroring both, I would say, both present problems or needs, but also looking into the future. For example, when we discussed about the knowledge issues, the skills issues, but also this about inclusion and exclusion, how we could work with that for the future population or older people population. So I think it was both.
Yeah. Helinä, what do you think?
I agree. Yes, I mean, in a way, you can say that the future perspective was also brought in by the stakeholder involvement, because we had so many user organizations, and as you mentioned, many types of stakeholder organizations participating. I also think that challenges, trends, and research needs, they are very much intertwined. So even though we were perhaps focusing at some point only or overwhelmingly on challenges or on trends, we were at the same time also kind of looking into the future. It's possible, of course, to have more, let's say, more visible elements of futures research at some point, of course. But I would say that in this project, it's we have this series of workshops. So and they focus on the 3 different levels: the users, the care professionals, and the society. So that's also one way of kind of including broader perspectives and therefore also being more future oriented.
Yeah, Elin, you looked into the present and future research, and yeah, I guess that's what you also saw, that it is here and now and also in the future.
Yes, and but of course we don't know how the technology will be in the future because it's developed so rapidly. But I think some of the main issues about competence needs and also to tackle all these rapid changes is important. And in a way, they are fundamental questions that we also need to cover in future. So, and we get more and more experiences digging into this area, and we will use what we learn also in the future. So I think it's relevant, but of course there will be new things that we don't know today.
Yeah, and I also, when I'm looking back to the workshops, I think our participants were very serious about this discussion because they tried to have a kind of neutral perspective in the discussion. Yes, I'm representing the retirement people organization, but when I'm looking to the future, I think the needs will be like this. That was the kind of discussion we held. And also when we discussed about the needs, I don't think today's needs are so similar of the future needs, but maybe the technology that will support us to meet these needs, to solve the problems, might be different. But again, I think we must work with the needs to express the need and explain the needs for the technology providers and the industry, the innovators. That's one of our challenges, to have a future perspective. Today, it's still, we are, so to say, in the hands of the technology providers, and they are not so broad quite often in the way they could support us in the care work or the daily life.
Helinä.
Yeah, I fully agree with what Christine said and Elin earlier too. And I would also highlight the role of decision makers. So they are also people and organizations who should have broader knowledge of needs as a whole, kind of on a broader level, but also also about the diversity of users, and somehow, even though they do not need and it's not possible to perhaps have very detailed knowledge of different groups' needs, but still on a broad level understanding that it's definitely so that there are no solutions that would fit everyone necessarily.
How is it out there? Any questions from you, the participants? There are some of you that were in the workshops, I know as well. Does this picture do we have the same picture as you have, or what do you say? Do you have any other questions? Please come in with questions. Yeah, Janne.
Thank you for the presentations, and I was lucky to be present at the Norwegian site of the workshop, and it was a nice workshop. So I thought I wanted to comment on the point which was presented, whether it's a clash between the requirements for universal design and that there are no solutions that will fit for all. It was a point that was made out because from the Norwegian session, we were discussing the need for universal design, and then in the Danish session, it was mentioned that there are no solutions that are fit for all, and they need to be individualized. I don't think there is really a you call that these are opposite, but the requirement for universal design was put forward by the Association for the Blind and Partially Sighted people, and they what they say is that if all technologies are universally or have the elements or requirements of universal design, they can be used, and these are kind of off-the-shelf technologies, everyday technologies like mobile phones, and in this way all people can use them. They will not use them in the same way, but they're actually usable for them, which will take or diminish the pressure for assistive technologies and for special solutions. So that's really why they bring that forward. They do that in every wherever we are together, or they will always bring that forward. And I think actually there's a requirement for universal design of IT and ICT solutions, but in the field of welfare technologies, they are not always fulfilled. So that was really what they wanted to bring forward. Thank you.
Yeah, this is a real challenge, isn't it? How should we deal with that, and how do we do it from a research perspective? Yes, difficult. And what do you any comment, Christine and Helinä and Elin?
Well, I think it's important to have the discussion. That's my idea of this. It would be great if we have universal design, but I don't know if it's possible. I mean, it's complex. I mean, if one disability might not fit with one other. There are individuals. There are also individual needs, individual skills. So I think we need to be somewhere in the between, or also flexible in this area. But another aspect of this is also today, it could be the situation that, for example, the home care staff, they have 17 different devices in their pockets when they were doing their daily work. And maybe there are patients or older people in the home where we fill their homes with different devices and 20 different electric cables. Maybe that's one of the angles of this discussion, that we need one kind of this holistic solution of platforms where we could have different choices corresponding to the needs.
Yeah.
So that's another angle, but in the same field, so to say. Yeah.
Helinä.
Yes, I think it's essentially about discussion, as Christine mentioned, concerning universal design and adapted services and devices. Discussion and also knowledge building, awareness raising, so on and so on, because we perhaps need to see that different people and different organizations have different roles in this regard. So whereas it can be important for instance, a technology company to understand universal design, then again, someone who makes practical decisions concerning an individual older person's services needs to have this understanding of diversity and solutions that are suitable for that particular person. So it's kind of perhaps different roles on different levels, and also definitely a question of balancing between these two issues.
This is connected to what we're discussing, but the digital exclusion challenge that we have. I thought a question that is this something that will sort of not be so much problem during the time that more and more people and elderly people foremost get more and more digital. But in fact, on the Swedish news today, there was a new result coming up from the yearly Swedes and the internet, and they stated now that nothing really happens. The digital excluded foremost elderly people, they are still as digital excluded as they were a year ago, 5 years ago, 8 years ago. So we have a real challenge when it comes to digital exclusion, and that's one of the 5 points, Elin, that we sort of discussed here. Yeah, you raised your hand. Are you muted?
So difficult to find the truth. Yes, it's maybe it's a part of the former discussion, because I think we will also in future have people that are digital excluded, and I think it's also important for us as researchers to look into how can we make services that cover both digital included and persons that are not are outside the digital era. So, and I think it will not disappear. And if we think that the future generation will be included, I think we do a big mistake. There will always be some people that will be outside that. So, but maybe from an optimistic view, if we are working close together with the vendors and also pointing that the needs for universal design and making technology that are easy to use. So I hope that in future some technology solutions will be more easy to use also for people that are mainly not digital, that the solutions are there without a need for actively take them into use. But of course, there you also have GDPR issues and so on. But I hope for some groups there will be better technology, but still we need to think on both.
And I think also this is an issue when we working with researching in this area. I had the opportunity to look into some Nordic research in this area, and one of my conclusions there were that I would say that sometimes we are a bit biased. The people who are included in the studies, the informants, the participants, are people who choose to participate in using telemedicine or digital devices and so on. So actually this is an area that needs research. You mentioned before comparative studies, but also what would make people to be included, to start using digital devices, and maybe what is the incentive for join the digital society? Or are there other choices behind of not being digital? Or is it not a choice? It's about what is offered, or is it economy, or I don't know. I don't think we know the story behind this. So this is an important research area.
Mm-hmm. I always highlight also that from my point of view, is that there are not so much research done on the analog social services, for example. I don't know how many research publications there have been on the user perspective of physical night patrols coming out, looking into if you're safe and sound, compared to we want to have research on digital night visits and so on. I don't know what your perspective is on this, Helinä.
Yes, well, related to this original question first about the exclusion, I also think that it will continue to exist, definitely, because aging will also in the future continue to affect us. We experience, of course, it's very individual how people experience various physical changes along with aging, but unless something really we find some miracle medicines or whatever, we will still continue in the future to experience changes in eyesight and manual dexterity and so on. And I'm also wondering, when we talk about digital exclusion, whether it's similar to other types of exclusion possibly in the future, because we can see that exclusion, like societal exclusion, may even be inherited from the previous generation. So will we see, hopefully not, of course, will we see kind of inherited digital exclusion in the future? That's perhaps one question. About these night patrols, there has been research on safety services done, Nordic research on the types of services that combine both physical services and digital services. So at least that kind of research exists.
Hello, everybody out there. Any questions from you? What are you sitting there and thinking, and what are your reactions of what you've heard and listened to here? Yeah, you have your chance here now to raise questions if you want to. Yeah, Anniki.
Yeah, thank you for a really nice presentation, a really interesting discussions. My question is about some of you, I think it was Christine talked about this user perspective and to involve users in the project and in the development of technology. Do you have any ideas about how it could be done? Because I think this is an issue which has been on topic several times, but how can we do it in the practical field? Since we have actually a project where we try to create a project based on user perspective and user involvement, and this connected to the discussion about exclusion and inclusion. Do you have any ideas about this kind of topic?
I'm sorry you directed a question to me. This is not my area.
No. It was not just you. No, all of you in the panel.
No, I think maybe there are other people who are more have more knowledge in this field. But I mean, one of the key questions is to involve users that represent as a broad user group as possible. Both the people who are interested in this kind of technology or digital ways to live your life, but also what we say excluded people. So that's my only comment. And there are different models how you could use this and work with user involvement, but this is not my area of expert. But maybe Elin is the expert in this area.
I will not say that I'm an expert, but I can try to say something. But I think really, or really involvement is hard work, and especially if you're going to involve persons that are outside or normally don't have to raise their hands and be active. But I think one aspect when you're planning the project, I think it's very important to put in enough time to the involvement. And I think the trend now is to not only to have user perspectives in limited areas when you're doing a project. You should involve early. Also, maybe users should be involved when you are formulating the problems, when you or through the whole project. But it's very time consuming, and it's not always easy. For you also have to think about how should I handle the perspectives from the users, and they are not always maybe the same perspectives that you have. So there are some special things to think about, but still I think it's really useful to try to do these exercises and try to think in new ways of involvement through the whole process, and also, as I mentioned, to have more resources to do that. But it's not a quick fix. So that was maybe some thoughts about that. But
thank you, Elin, because that's what we are struggling with. How should we continue? And I agree with you that it's really important. It's the core of the whole thing that we have the use with us, because otherwise we can't develop that kind of things that we want to do if we don't have them. So thank you for the answer. Thank you.
Thank you. And then we have a question from Helinä.
Thank you, Bengt. And thank you very much for a most interesting hearing from all three of you. I do have a question. I'm a political scientist and involved in disability policy development. And I do wish to have your reflection on the need of policy development issues, as well as future, as well as future directions on policy statements, and not the least regarding the four Nordic countries. What do you see? What kind of trends do you see? What kind of needs? It would be very interesting to hear you discuss that.
Interesting question. As I was presented, I'm working at Mälardalen University, but I also have a second work. I work with quality management and development in Eskilstuna municipality. And so I'm in the middle of this discussion on a local level with politicians. And as you know, we are facing, or we are in the middle of a demographic challenge. There is a growing population of older people. There are not enough people who will be the care workers. And we also have limited financial resources. So how should we manage the future needs due to these challenges? And as we're working on the local, very local level in Eskilstuna municipality, there is some kind of policy that says that whenever it's possible and ethical, we need to replace someone with something. That's some kind of trend that we are working with. I think also it's what the politicians also consider due to the responsibility area. Then you of course have political issues as well, but this is a pragmatic way to look into what we are facing in this way. But of course we need to do it in a correct way, or as correct as possible. And here we need the safety and security issues to be very much worked with and also researched. and of course the ethics of it. Though if we look into the Western culture, it's a very high cultural value to stay independent. And I think that this is something that corresponds to this trend as well. So what I will come to is that I think we need to work more proactive versus reactive to support people to stay independent, or if we're talking of people with disability, to develop their independency. So I think this is one of the key questions, and it is about safety and security. To feel safe, to feel secure in your own home. So this is a very broad answer to your question, but I think this is the kind of a trend, and it refers to policy questions as well.
That's true.
I think, yeah, Elin.
Bengt, I think Helinä was first.
Helinä is before.
Oh, sorry. So Helinä first. So you have
Okay.
bookshelf. Your bookshelf, so it's a little bit yellow there, so I couldn't see your yellow hand. Sorry.
No problem.
It's an ethical issue, Bengt.
No offense taken. Yes. Specifically related to people with disabilities and policy development, I think that there is still much less attention towards people with disabilities than older people, for instance, when you talk about use of health and welfare technology. And this is also very visible in policy development. So again, as I've been highlighting the user diversity and the need to understand that, I would again highlight it also in policy development, because you can see that the view of health and welfare technology users is still quite narrow. And this also concerns people with disabilities in working age who are working, employed in various types of occupations, and who could benefit greatly from different solutions of health and welfare technology. But this is kind of not supported or not understood. So it's the views of users in policy development is also quite stereotypical in many ways.
I can just supply that I think the issues Christina was highlighting about the trends and the challenges, and also the moments from Helinä. I think we really need to increase our competence, and also for the health personnel and also for the planners who are planning for the future, because these issues are so extremely complex and the answers are not there yet, how we can deal with all these problems. So, and also there's also a danger about a responsibility shift, that because of the lack of resources, there will be a lot of the responsibility often will be put on relatives, informal caregivers, and also on the persons themselves. So, and we need to know when this is okay and then when it's not okay, and also some ethical issues around this. So we really need to know more about the consequences, and also of what we decide to do, and maybe what we not decide to do to meet these challenges.
Mm-hmm. I would just like to comment on Helena's question there from my point of view, not from a research point of view, from Nordic Council of Ministers point of view. I worked at the Nordic Welfare Centre in 2012, and I can see a large difference now to 2021 when it comes to how authorities, governments, Nordic Council of Ministers, and we work on these issues. When we are much more bottom up now. I think we look into from the micro, from the macro meso perspective, knowing that we need to really look into what works on the micro level that will go on. For example, we work like lots of perspectives out of rural areas. We can see that what works in rural areas works in suburban areas. It's going on the right direction, I think. If you compare from 2012, I'm happy with that. I must comment that. Janne.
Yeah, I was thinking about the same thing. We have been planning several sessions for the EHIN conference in Norway, where I think some of us will meet. Hopefully, a lot of us will meet.
Hopefully, yes.
in November. And I'm attending several sessions there. I think that even though there are so many challenges, we are really lucky to live in Nordic countries. I think I just gave a presentation in Ireland. You helped me a bit with the information there, Bengt. And digital exclusion is a far larger problem in other parts of Europe. We have this network. We work together. In Norway, we have, of course, a national program which has kind of pushed this progression or development forward. We can learn from each other. There's I think that, like at least in Norway, the municipality is in charge of a lot of the services, which means that it's not divided, further increasing the complexity. So we have, I think we have a lot of, going for us, even though it's a lot of challenges. And of course, we should address them, and we really should do what we do now. We address them together. So I think we're a bit lucky, really, even though it's difficult. We are in a privileged position. So thank you for having this network and the project as well. As it brings forward important knowledge, and also the connection between research and the governments. Because at least in Norway, they have been working with this field without really, bringing in the research. So there has been research going on, but it has been a bit slow to actually, bring in the research. So I think that being in a network like this, the impact of research will be stronger as well. So that's a good thing.
Yeah. And I promise you, we will push on. We won't stop. This is just the beginning.
Bengt, there are also some comments. So maybe before we close the session.
I see there's a question from Anniki. I'm also wondering if it's totally impossible to combine the development of technology based on universal design. Yeah. Who wants to answer that?
It's a yes or no question, and I don't think it's totally impossible. No, but there are challenges, I believe.
I believe it can be absolutely done. And then we have Toril also, safety and security on the safety. One aspect that often is forgotten, neglected, is the user's needs ability to cope and succeed with everyday living beyond safety and security. That assistive technology may support performance of daily tasks, which enable people to have better lives. Yeah. Comments on that?
Yeah, it's true.
Very true.
Yeah, but sometimes we may stay at the basic level, the basic needs, but of course there are other possibilities. For example, people with intellectual disability. In one study I was a participant in, they said that they are more equal by using internet, because you are not facing people in the same way as in a room where it might be visible that you have a disability or something. So of course there are possibility for better life and also more equal lives in that aspect. But there must be many more aspects that support us to live richer and better lives. There's also wonderful, I've seen it on YouTube, people with profound disability that are working in cafes in Tokyo. You might have seen that, and they are in their home mastering robots who working in cafes. And it opens up a very different labor market even for people with profound disabilities. So that's wonderful innovations. Yeah.
And I think now it's just 5 minutes left, and I think we just go to all three. And I thought there were 2 short questions. Was it anything that surprised you during these 2 workshops? And how about the differences or similarities between the Nordic countries? Anything you that you have been thinking of afterwards? Christine?
I wasn't so surprised, because when we look into the summarizations, that we are quite similar. We might use different words, have different ways of talking about the issues or needs or challenges or trends, but we are quite similar, I would say.
Yeah. And Elin, what do you say?
I think I will say much of the same, maybe more thinking about the similarities than the differences, and very much the same question were raised from the different countries. So I think we have a lot of things in common. That's the basic, I think, from the workshops.
I also thought that it was, I was not very surprised. I was happy to see the similarities unfold themselves or unearth the similarities, but also I think that we can learn a lot from each other, both from the differences and the similarities. And in line with the similarities, we are also stronger together as a region.
Maybe just another comment. Maybe there will be more differences when it comes to policy and in the next discussions, but we will see. So it will be exciting to follow these workshops.
Yeah. And one of the ideas with the project is also to serve the researchers ideas for further research that is needed and asked for, required from these different areas, the users, the professionals and the society. So as you say, I think we are stronger together, and it also gives me energy to why I should use this group or network for our development. We are stronger together.
We are stronger together. Yeah, perfect. Thank you very much, Christine, Elin, and Helinä for this. It's been very nice to talk to you and listen to you doing this presentation. And we will go on with this project, and we will for sure come back. Before we leave this meeting, just a minute left. I just want to say that on EHIN, as Janne mentioned, we will be in Oslo on the 9th and 10th of November. So if you will be in EHIN or will come to EHIN, we will have a network meeting that we will also think we will open up to participate on distance between 3 o'clock and 5 o'clock on the 9th. We will get back to you all in the network about that. We'll send information. And on the 10th, we have a whole day. We're presenting from Nordforsk, for example, also 5 research presentations, but also we will also have some projects on the agenda on the 10th of November in Oslo. And I think also hybrid on via video you can participate. because that's very good. We had Helinä that's been sharing the network during 2021 as Finland as the chairmanship of the Nordic Council of Ministers, and then we now start planning in Oslo at Helinä, also planning for that Norway will take over to be sharing the network for the next year, because Norway has the chairmanship of the Nordic Council of Ministers, and we follow that in this Nordic network. So again, Christine, Helinä, and Elin, thank you very much, and thank you all that participated and put questions, and hopefully we see you soon again. Thank you. Bye-bye.